Another critical aspect of teamwork is effective team leadership. Team leaders are well-informed team members who make decisions and take actions. Team leaders establish the goals of the team and help maintain its focus. There are two types of leaders, designated and situational. For a team to function successfully, a leader must be designated. In most clinical situations, the person with the most training is in charge as the designated team leader. Situational leaders emerge at designated times, such as during multi-casualty incidences or prior to an ambulance arriving. When leading teams, both designated and situational team leaders must possess a set of effective skills regardless of the type of team they are leading or the situation in which they are leading it. At its core, leading teams involves the following activities: identifying a goal and defining a plan to achieve the goal, assigning tasks and responsibilities, sharing the plan, monitoring the plan and progress toward the goal, modifying the plan and communicating changes to all team members, and reviewing the team's performance. It is critical that when leading teams, designated and situational leaders also establish rules of engagement under which team members will operate and perform their roles. Manage and allocate resources effectively to ensure team members have what they need to be successful. Provide feedback to team members regarding their assigned responsibilities and progress toward the team's goal. Facilitate information sharing among team members. Encourage team members to assist one another when needed. Facilitate conflict resolution and model effective teamwork. Leading teams involves team events that include the activities of planning, problem solving, and process improvement. Three strategies that team leaders can use to facilitate these activities and promote teamwork are briefs, huddles, and debriefs. As shown on the slide, briefs are conducted at the start of a shift or a case, for example, to share a plan with a team. We'll review briefs in more detail shortly. Huddles are ad hoc sessions to review and modify the established plans. These may involve reviewing the plans to ensure all team members continue to be on the same page or adjusting the plan based on known or anticipated changes. Debriefs are conducted to review what has occurred, such as after a case. These sessions are intended to improve team performance by identifying and reinforcing what went well and what can be improved. We'll review debriefs in more detail shortly. Briefs are a strategy for sharing the plan when leading a team. During a brief, which is sometimes referred to as a team meeting, the following information should be discussed: team membership and roles, who is on the team and who is designated team leader. In cases of EMS, that may already have been established by rank or position. Clinical status of the team's patient, the current condition, diagnosis, and status of each patient assigned to the team. The plan of care for each of the team's patients, what is to be accomplished, what are the expected outcomes, and who is to do it, and issues affecting team operations, resources normally available that may be restricted during the current shift. Defining clear goals and a plan to achieve those goals is an important part of the brief, as well as establishing clear goals and expectations for each team member. Successful teams measure their effectiveness in terms of how well they are performing against the established plan. The designated team leader usually conducts the brief, and team members actively participate. Similar to a pre-flight checklist used in aviation, the team leader should cover the items on this or a similar checklist. Conducting a brief at the beginning of a shift or prior to a case provides an ideal forum for communicating with other team members about the goals of each patient and the plan of care to ensure patient safety. Now let's look at a team conducting a brief with a short video clip from a hospital situation.
Okay, she currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push. If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use it.
Great. I'll discuss this plan with Mrs. Keys when we're done here. What are her vitals right now?
Normal, just checked 15 minutes ago.
She's had no late deceleration since you recall.
Well, let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage. Any questions?
So let's look at the video clip we just watched. Who is the designated team leader? Dr. Upton. He set the tone by coordinating the brief and establishing a plan of care for Mrs. Keys. Did the team develop a comprehensive plan for Mrs. Keys? Yes, Dr. Upton sought input from all team members before communicating the care plan. Team members were well aware of their roles and responsibilities and were eager to share information. Questions were encouraged. Did the team address contingencies, and was the patient included in those discussions? The answer is yes. The team understood what specific factors could lead to C-section, and Dr. Upton made plans to communicate that information to Mrs. Keys. The brief checklist is probably not something that would be done while attending to a patient because of the nature of EMS responses. However, it certainly could be done by a team leader and the team members at the beginning of a shift, for example. Research has shown that teams who effectively debrief their own performance can improve their teamwork in real time. Debriefs include accurate recounting and documentation of key events, analysis of why the event occurred, what worked, and what did not work, discussion of lessons learned and how the team can alter the plan for the next time, reinforcement of what went well and how the team can repeat the behavior or plan the next time, and establishment of a method to formally change the existing plan to incorporate lessons learned. Debriefs are most effective when conducted in an environment where honest mistakes are viewed as learning opportunities. Debriefs can be a brief, about 3 minutes or less, team event, typically initiated and facilitated by the team leader. This checklist can be used by the team during a debriefing to ensure that all information is discussed. Here are 2 guidelines for conducting debriefs. 1. Facilitate the discussion as a leader by asking questions related to team performance. For example, questions might include, what did we do well? What did not go well that we could improve? And number 2, recap the situation, background, and key events that occurred. Similar to the brief, the team leader should cover the items on this or a similar debrief checklist. This checklist can be used by the team during a debriefing to ensure that all information is discussed. The team leader should then summarize lessons learned and set goals for improvement. These leadership techniques also help in maintaining an awareness of what is happening in your unit or in your agency or your team with your team members. Situation monitoring is a continuous process that all team members should participate in. Situation monitoring is a continuous process because of the dynamic situations in which teams function. This process consists of 3 components. Number 1, situation monitoring, which is an individual skill, is the process of actively scanning and assessing elements of the situation to gain information or maintain an accurate understanding of the situation in which the team functions. Situation monitoring is a skill, which implies that it can be trained, developed, and improved. It enables team members to identify potential issues or minor deviations early enough so that they can correct and handle them before they become a problem or pose harm to the patient. Number 2, situational awareness, an individual outcome, is the state of knowing the conditions that affect one's work. It is a detailed picture of the situation. Note that situation awareness is not a static thing or concept. Because the situation and context in which the situation exists are dynamic and ever-changing, team members must continually assess relevant components of the situation and update their individual situation awareness. And third, shared mental models, a team outcome, are the result of each team member maintaining his or her situation awareness and sharing relevant facts with the entire team. Doing so helps ensure that everyone on the team is on the same page. So think about, when have you used situation monitoring in your work? How did the information that you obtained from the environment affect how you approached or responded to the situation? So here are some examples from the hospital environment. First, the respiratory therapist notes that a ventilated patient is showing a marked increase in respiratory rate that might indicate an increased level of pain that cannot be communicated. That's the status. The patient's nurse is busy helping another patient. That's the team members. It is shift change and everyone is busy, so you check the medication record and note that the patient is overdue for his morphine. That's the environment. And you notify the oncoming nurse of your concern. That's the progress toward the goal. In a healthcare setting, the most obvious element of the situation requiring constant monitoring is your patient's status. Even minor changes in the patient's vital signs may require dramatic changes in the team's actions and the urgency of its response. When assessing patient status, consider the patient history, vital signs, medications, physical exam, plan of care, and psychosocial conditions such as the patient's stress level. You should also be aware of team member status, including fatigue level, workload, task performance, skill level, and stress level. You should be aware of the environment, including facility information, administrative information, human resources, triage acuity, and equipment. And finally, you should assess your progress toward goals by asking key questions. These questions are: what is the status of the team's patients? Has the team established goals? Has the team accomplished their tasks or actions? Is the plan still appropriate? Healthcare providers are just as prone to human error as the general population. Teams that recognize and maintain an awareness of their individual team members' functioning are more likely to provide constructive feedback, have a shared understanding of the situation, and lend support or assistance when needed. Observing the actions of fellow team members or cross-monitoring is a safety mechanism that can be used to mitigate error before the patient is harmed. Commonly referred to as watching each other's back, monitoring other team members by keeping track of their behavior and providing feedback ensures that procedures are being followed appropriately. It allows team members to self-correct their actions if necessary. Staff members need to constantly be aware of the situation, anticipate next steps, watch each other's back, and take appropriate corrective action to prevent errors from reaching the patient.